Hello everyone, it's Shooter 13 on scene here at the homestead, and I want to share with you our improvised field expedient meter dose inhaler spacer chamber. Something that I formed together out of necessity, out of parts I actually had on hand. I didn't buy a single thing for this. Everything here, I don't know where the parts came from, but they were here. Alright, let's get into the kit contents. The spacer chamber is made from a recycled clear tube mailer with holes cut into the ends to fit the items that I want to put in there. Just remember to cut the holes a little small so we have a nice snug fit and you'll get a good seal. And the next item here is the one-way valve, which I salvaged out of this. I don't know what this meta breather thing is used for or how I got it, where it came from, but that's where it is, and works out really good for what how I want to use it. And then here's a mouthpiece with an expandable tubing that came out of one of these volumetric incentive things. I'm not sure exactly how that's used either or where I got it, but there you go. Another thing is the airway connector with a swivel. That's really useful, as you'll see soon enough. And some recycled inhaler dispensers. They've been cold sterilized, so don't freak out, any of you people who freak out on such things. And just rest assured that they'll only be used during austere conditions, and that the person that they are recycled from, or the individuals they're recycled from, don't have anything to worry about. So it's pretty simple to put together. You just insert that. You insert whatever inhaler you had available at the end there. Put the one-way valve in. Really simple, huh? Swivels around in the direction that you need it to. Pop either a mouthpiece on, and you can see, pop a little boop, give it I would, because of that spacer there in the diameter, I would go ahead and give it a couple of hits inside that chamber just to give that person a good full dose of whatever they need a dose of. And then you can see any resuscitation mask will fit that. So it makes it really nice and easy to deliver that if somebody needs to use that more than they can the mouthpiece, or say you're trying to deliver it to somebody who's semi-conscious. And then here's a infant resuscitation mask where I use that swivel or the airway connector. And then you can see here, let's see how coordinated I am. You can see here how well that will work to deliver that to really any patient where that size mask would fit the swivel. But that right there would be really good for delivering it to an infant and small child that mask would fit on with that swivel. And then I don't even know why I put that on there. It's just a different mask. But you can see another bag valve mask, a resuscitator mask, works just fine. Okay, and for my 1 millionth try on this voiceover for the Canine Feline Recovery Oxygen Mask Set, there's a Large-Feline, which also fits pug dogs, and then there is the long snout type cone that fits larger and smaller muzzles of dogs. See the important note scrolling across the bottom of the screen to remind you to occlude the green exhalation ports in order for that mask to be effective on any of those masks there. If you don't do that, it won't work. They're not going to get any of the drug. So remember that. And then there's just an overview. You can just see how it kind of almost looks like it was made like that. It's a pretty nice little kit. I wish I could find some more of those recovery tubes, because they're I would just like to make a few more kits out of that. If I could get all the other parts. Alright, and then last but not least here, it's really important to have some type of anti-static something or other going on inside that plastic, because it will create static in there, build up, and all the mist will get sucked right up onto the plastic. It's really interesting to see happen. So I have a non-scented fabric softener sheet that I just wiped the whole interior out with, and that completely prevents that from happening. Okay, I'm just gonna close out the video with the credits, and then also the scope of practice for this kit, so that you can see what my intentions were when I set this thing up. Okay, I think that I've communicated all the things that I thought were important about this improvised field expedient asthma spacer chamber inhaler. I don't know what you want to call it. I was going to call it the 285 improvised inhaler, because it's got 285 written on it for some reason. So, anyway, that's it. This is Unit 13, and I'm going to be out of here.